Back in 2003, I was living in the village of Kaskikot, Nepal, and I began to notice that people were coming to the house where I was living with a local family and asking for help with dental problems. And I began to wonder, what's going on here? So I started to look into it, and as it turns out, dental medicine is entirely excluded from the public health system in rural Nepal. And the result is that oral disease is one of the most prevalent health problems in the country. Now, this is not a peripheral thing. It's related to many other illnesses, including malnutrition and cardiac disease. Oral cancer is actually Nepal's most prevalent cancer. So I started problem solving with local teachers, and our efforts evolved over time and became Jevaia Oral Healthcare, which is the only rural oral healthcare project in Nepal. Now, in each village where we work, there's a team of 3 people, a technician, a clinic assistant, and a team leader who are all residents of that village. We pair with a Nepalese NGO that trains the technician in specialized dental techniques, and then the technician starts a dental clinic in the government health post so that we're integrated with the local healthcare system in that village. In addition to the clinics, the teams do 3 other things. The first is they do community outreach to address prevention, to provide information about the clinic, and to offer free screenings. The local team also works with schools to bring prevention and oral health education into the school system through our school brushing program. And finally, they do outreach with village shopkeepers, and that ensures that dental hygiene products are available locally where they're easy to get. So currently we have 8 clinics that cover an area of about 60,000 people, but our full-time admin staff in Nepal is just 4 people. All of them are Nepali. My role as our executive director is to be a bridge between Nepal and the international community. And I also do all of our fundraising. In addition, I spend 2 to 4 months a year in Nepal. I've been doing that for the last 14 years, so I'm intimately familiar with rural life, and I speak fluent Nepali as well. Other than that, the rest of our staff is Nepali, mostly residents of rural villages, and that's really the unique strength of Jevaia, is that it's had beneficiaries involved in its development and execution since the start. And also that we're creating employment for people in their own villages so that they can address a need there. Now, the innovation here is simple. It's assuming that everyone should have care. The techniques that are used in our clinics existed before, they're well researched and known to be safe and effective, but most people in these regions rely on camps or outreach programs in order to get the care. So rather than trying to transplant urban methods to a remote context wholesale, we've innovated from the ground up, and we're not afraid to try new things that prioritize access and dignity for people. So now we're ready to think big on sustainability, and we'd like to see this model backed by the National Health System of Nepal and adopted into all of its rural health posts, which serve another 20 million people. We've actually already started advocating for this policy change. This is me last summer speaking with district level officials in Nepal. And if Nepal's government would agree to fund established dental clinics, that would incentivize the global aid community, which currently spends nearly $1 billion a year in Nepal, to follow our blueprint and set up these clinics. Of course, in order to do this, it's critical that we have data on the efficacy and safety of our model, and we've already started collaborating with a number of U.S. universities on research and program evaluation. The most exciting research at this time looks at the outcomes of procedures performed by our technicians and how they compare to when fully credentialed dentists perform the same techniques. But in addition, we use surveys to evaluate changes in oral health knowledge and behavior patterns. So to meet our future goals, we need to double our annual budget from $100,000 to $200,000 a year. Most of our funding comes from private donors with some small grants, but we'll use the Innovation Prize to ramp up our government advocacy and the data collection that's needed to support it, because that's really what's ultimately going to allow what we've developed to reach the most people. So this is an exciting time for us. After years of work, we have the ear of policymakers and researchers asking what it is about our innovative program that's working, and I hope you'll join us on the next stage of our journey.